And as you said, this is a complex policy issue, and it's put before voters in a very simple ballot question. Now, there's not a whole lot of hard data. Only one state has ever passed a similar law, and there are wildly different predictions about the impact.
Nurses in Massachusetts make decisions that save lives.
Who should you believe? Nurses saying yes?
I'm an emergency room nurse and I support safe patient limit.
Or nurses saying no?
I feel like I'm the patient's quarterback. I know what they need, so don't take that away from me.
People see this and see the ads and are confused. What should they think?
They should think they're not crazy, that it is incredibly confusing. I'm a political scientist. I get paid to do politics. And this issue 1 is confusing to all of us.
This is clear. A yes vote would create a new law that limits the number of patients assigned to each nurse. A no vote means hospitals would continue to decide staffing levels. Right now, California is the only state in the country to enact nurse-to-patient ratios. In Massachusetts, they vary depending on the type of care. One nurse for every 5 patients in rehab, for example, but one nurse for just 1 patient allowed in most critical or intensive care situations. Penalties for a violation up to $25,000 a day. When it comes to costs, it's not so clear. The nurses union pushing for a yes on question 1 puts the price tag at up to $47 million a year. Those opposing it say it would cost nearly 30 times that amount, $1.3 billion the first year and $900 million each year after that, landing on hospitals and ultimately patients. Tomorrow, voters could get some clarity, at least on the estimated cost, when the state's Health Policy Commission meets to release its analysis.
It's sort of like, throwing the flag on the play and all of a sudden, okay, this sort of turns the tide.
UMass Boston professor Aaron O'Brien says this one number could be what otherwise confused voters use to make up their minds. Expect to see it in a lot of new ads.
Most voters aren't going to read these cost estimates. That's just not what people do, understandably. But as a political symbol, that number will matter tremendously.
And as you can imagine, there is also a split about this commission coming out with the cost estimate. The no side is welcoming the commission's findings. The yes is questioning how the review was conducted. More to come when it's released tomorrow. Live at our State House Bureau, Karen Anderson, 5 Investigates.
Right.